Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome everyone. I have Constance Banks with me here today, and she has a fabulous presentation coming up, Building Breastfeeding Foundations, a roadmap for transitioning preterm infants from bottle to breast. Welcome, Constance. It's so good to have you here today.
Thank you, Fiona. I'm happy
Yeah.
to be here.
I know that you are so passionate about this area, and I think that we can all agree that this has still got there's a lot of gaps when it comes to this area of breastfeeding. Why do you think that that is? Why do you think that we're still seeing those gaps?
Well, we don't follow the evidence that we really should start babies to be close to their mothers for as long as possible and as much as possible, and
Hmm.
also introduce them in the care of their babies.
Right. I mean, it's just so fascinating. And I mean, with as an estimate, there's 15 million babies born prematurely every year globally. We really should be paying a little bit more attention to this, I feel.
Absolutely. Also because there is whatever happens in their neonatal period, in that time they are in hospital and also in those early days with their parents, it affects their whole life.
Right.
And especially the nurturing aspect.
Hmm.
And breastfeeding is obviously a huge part of nurturing a baby.
Yeah. Yeah, absolutely. And this is a worldwide issue because there isn't, I mean, some countries are doing better than others, but we're even in the countries that are doing better, they're still lagging behind where, the World Health Organization, anticipates they should be and those types of things. So why do you think it's taken us t so long to close the gap in this type of care? Is it because we didn't have the research? Is it because we were dismissive in some way? Tell me what your thoughts are, Constance, in
Well,
this.
my thoughts are, first of all, the resources.
Hmm.
It's we focus on the patient, and the patient is the baby.
Right.
And the parent is not seen as part of the baby. That's how I see it. So Winnicott is a psychoanalyst, a children's psychoanalyst or psychiatrist of the past. And one of the things that is always in my mind is there's no such thing like a baby. There's a baby and someone. And the someone is the birth parent
Mm.
or the caregiver. And if that caregiver is not present for so many weeks in that early life of that baby, because yeah, I mean, we're talking about this baby normally gestationing in the womb of the parent, and now this baby is in an isolate.
Oh,
So,
that,
and
I was going
and
to
I
say
actually,
that.
whilst I was doing the presentation, I was thinking, why do we even call it isolate? We're isolating the baby from
Yes.
the parent.
Yeah,
So,
absolutely. Yeah, it just gave me complete goosebumps, when you were saying that out loud. I mean, I've worked with many babies that have come through the NICU and, into the home. And I have been a NICU parent, so, I've been a witness to this as well. And and the interesting thing is, can I just have a little moan, please, Constance?
sure.
I have a son who is in his 30s. Okay, I know that's going to age me a little bit, but he was in the NICU, and some of the things that were happening then are still happening now.
Yeah,
So, that tells me a lot. I feel that some things have moved forward and some things have really slid back. It's so
yeah,
fascinating, to the point where we're still not including the breastfeeding parent, the gestational parent,
yeah,
as part of the solution or just part of the couplet. I mean, for years and years, and like you
yeah.
said, if in those last couple of weeks, this is what really stood out for me when you said that was that the if the baby would be finishing their gestation within the womb at that point, should be, right? But no, they're in the NICU
Mm,
and they're now separated from everything that they should be with. It should have happened. And so surely that has to set them back. It's
absolutely.
like a no-brainer.
Yeah.
But
There was
here
a
we
very
are.
good documentary recently, actually, on German television on just a case study on somebody who's now a university student who was born very prematurely, and
Right.
how it has actually affected his whole life, because
Mm-hmm.
he, and it's still affecting him. So, and that's just one case study. So yeah, so it's
Yeah.
certainly yeah, I'm very passionate about that topic, because I would love to see, yeah, parents so much more included. To for a parent to come into a NICU and ask the nurse if she's allowed to cuddle her baby,
Right.
to get permission
Yes.
for
Craziness.
that is just doesn't sound right for me. And as I said, I
No.
mean, there's just not enough resources,
Yeah.
and there's the educational part of it that is a
Yeah.
big part.
I would love to be and I know in some places I've heard of this happening, but I'd love to be that advocate on site right away, coaching that parent through that next step in that process so that they know what's happening because they're in shock. There's a lot going on, and I think that they just kind of lay down, themselves at the mercy,
Mm,
and everyone is so grateful for what happens in NICUs, of course, often life-saving,
yeah.
and so forth and so on. But there are definite gaps. Like you said, we're starting to see some of these longitudinal studies that we see that children, adults are in fact impacted long term. But I do want to shout out to our NICUs that are working towards this and are changing things. But we know that we can continue to do better. I think in your presentation, what really struck me the most was just really laying out everything really that has impacted the entire, family, from the physiological to the psychological aspects, and some of the things that still happen where there just isn't enough time or knowledge, and a parent is never going to know. Constance, where they're, depending on what hospital they end up in, they're not going to know, the skill level there. So when it comes to our professionals who work in the field and our lactation folks who are listening in, what are some of the values that you hope that they will start to, support families in that interim that they can really do themselves, either in education or teaching or, in that postpartum period? What would you hope to close the gap?
What I would hope for is that neonatal nurses would be maybe more like midwives,
Mm,
because, when midwives used to work in neonatal nurseries or in
right.
NICUs, they had much more of that empathy for the mother, what she's gone through,
Mm-hmm.
because they've looked at the mother as a or the birth parent as a pregnant person, and
Right.
and so it was not just the baby as the
Mm-hmm.
focus. And so I think that would change a lot if we could really include parents much more. And also, one of the things that I feel would be closing the gap is when the community health center or the community nurse would come into the hospital to make contact with, work in collaboration, but would make contact with the parent and meet the baby before they get discharged, so that there
Mm,
is that continuity of care,
right.
rather than they're gone now and that's it. I mean, so yeah, so that would be sort of one of my ideas. And having had conversation online with Mary Coughlin on the
Oh,
trauma-informed care in
yes.
NICU, that was just so valuable, because it really it kind of answers a lot of my frustrations over the years that I had. We need to look after the staff as well,
All
because
right. Yeah.
if this because the staff do the best they can,
Mm-hmm.
but if they haven't got the chance to see that they're making a difference in the lives of these babies, not just on the medical level, on the physiological level, but that what they do impacts the mental health of the mother and the baby long term, I think that would be part of this closing the gap as well. So, yeah.
Yeah, so valuable lessons I think that we're continuing to learn.
Yeah,
And I think that, teaching, educating the next generation is going to be as valuable as well to understand what we have learned, what we know is working, but what we know is not working. Um,
absolutely. Yeah.
yeah, and having these consequences. Constance, my goodness, it is an absolute pleasure having you here at Gold. And your presentation is going to be online as part of our conference this year, which is going to be fabulous. As soon as you register and our conference opens, you'll actually be able to log in and look at one of these presentations as part of this package of our preterm infants, which is going to be fabulous over on goldlactation.com. Thank you so much once again, Constance Banks, for being with me here today. It was absolutely fabulous chatting with you.
Thank you, Fiona. Likewise.
Well, thank you again, and I hope that we'll see you all very soon online. Bye bye for now, everyone.